Lefort fracture. Lefort 1 fracture above the nasal floor, extend backwards from the lateral margin of the anterior nasal aperture. Below the zygomatic buttress, below the zygomatic buttress, to cross pterygoid lamina. So lefort fracture above the nasal floor, extend backwards from the, what are the fracture line of lefort 1 fracture? Lefort 1 fracture lines above the nasal floor, extend backwards from the lateral margin of the anterior nasal aperture or piriform nasal aperture. Below zygomatic buttress to cross the pterygoid lamina. Pterygoid lamina is lower third. Lower third. And it is the lateral fracture. It is the lateral fracture, and also passes along lateral wall of the nose, and lower third of the nasal septum. Lower third of the nasal septum to join the lateral fracture. Behind the maxillary tuberosity. So lefort fracture, we discuss here the lefort 1 fracture line above the nasal floor, extend backwards from the lateral margin of the piriform nasal aperture, anterior nasal apertures below the zygomatic buttress, and to cross the pterygoid lamina lower third. Is the lateral fracture. Then it also passes along the lateral wall of the nose and lower third of the nasal septum, then to join the lateral fracture behind the maxillary tuberosity. So if we marking here the which structures are involved here, there's above the nasal floor, we remember, then anterior nasal aperture, then zygomatic buttress, and 4 pterygoid lamina, and also passes along the lateral wall of the nose. There's lower third of the nasal septum, and to join the lateral fracture. behind the maxillary tuberosity. So you can remember here 7 points: that above the nasal floor, then anterior nasal aperture, is extend backwards from the lateral margin of the anterior nasal aperture, extend backwards from the lateral margin of the anterior nasal apertures below the zygomatic buttress to cross the pterygoid lamina. And it also passes along the lateral wall of the nose and lower third of the nasal septum to join the lateral fracture behind the maxillary tuberosity.